Coming up, we'll be on location at Charter Radiology in Columbia, Maryland, discussing the latest advances in radiology medical imaging and the many patient benefits with one of this region's top radiologists, Dr. Arvinder Uppal. Dr. Uppal is a board-certified radiologist and received her medical degree from Albany Medical College in New York and completed her residency in radiology at Albany Medical Center. Dr. Uppal received her fellowship in body imaging from Johns Hopkins Hospital and is widely recognized as one of this region's top doctors. Welcome, Dr. Uppal. It's a pleasure having you on our program.
Thank you so much.
It's your first time, in fact, on the Top Doctors Medical Interviews. We have a lot to talk about. We have several patients that are going to be joining us a bit later. But I wanted to begin, if I may, Doctor, by having you tell us what some of the latest advances in radiology medical imaging are and how we can benefit from them.
So there have been a lot of advances lately in imaging. But one of the key advances that we're going to be talking about and during the several next interviews is the advent of the 3 Tesla MRI. And with that, there has been the advancement of the highest resolution with the 3 Tesla MRI and the use of the great resolution in imaging of several body parts in MRI. Today, we're going to be talking about imaging of breast MRI and MR-Enterography. Those are the 2 areas that we're going to be talking about.
I wanted to ask you, Dr. Uppal, how is a breast MRI performed?
Patient is lying face down into the breast coil, and one of the most important things in performing a breast MRI is that the breast has to be positioned correctly so that all of the breast tissue is covered, so that breast cancer should not be missed. And that's why I, as a radiologist, actually position each woman. The examination typically takes about 15 to 20 minutes. I actually go over the images with the patient after the examination is finished.
That is significant. In other words, as opposed to the norm out there when you're talking about radiology practices where you have the MRI and then you leave and then you wait to get the results back, and it's generally not the doctor calling you with the results, it's someone else. In your particular practice here at Charter Radiology, you're talking about getting the patients the results within minutes of having the MRI done, and you generally are the one who gives them the results.
Yes, I do feel that breast MRI and breast cancer is a very anxiety-provoking examination, so most women do want to know the results. The women who come into having a breast MRI usually are coming in because either they have a diagnosis of breast cancer or are coming in for screening breast MRI, and so they want to know if they have breast cancer or not. So usually most of us do not want to wait 24 or 48 hours to know if they have or do not have breast cancer. So usually before they leave the imaging center, they usually know at Charter Radiology if they have breast cancer or not. And I usually then call the referring physician right after they have left and then give the results to their referring physician.
Yeah, so that's a tremendous benefit that you provide here, which, as I mentioned a few moments ago, is certainly very unique.
It is.
And all to the patient's benefit, because you're right, the anxiety level is at an all-time high when someone's coming in to have a breast MRI to know whether or not they have cancer. And to know they're getting the results within minutes from you directly, doctor, is very impressive indeed.
Yes, I discussed the results in great detail with the patient if they have breast cancer or they don't have breast cancer.
Now, how does a patient prepare for this?
There is really no preparation involved. Only if the patient is above 55 years of age, we usually check their renal function, but other than that, there is really no preparation involved. And if the patient has had any prior mammograms or any prior studies, we usually ask them to bring their studies.
And what types of problems can be detected from the breast MRI, Dr. Uppal?
So breast MRI is the most diagnostic examination to screen for breast carcinoma, that is breast cancer, and to look at the integrity, if a patient has breast implants, to look at the integrity of breast implants.
And why would you say that it's so important for women watching today to have a breast MRI?
If you have a very strong family history of breast cancer, you would want to have a screening breast MRI. If you have an abnormal mammogram, you would want to have a breast MRI. If you have history of breast cancer, you would want to have a breast MRI. If you have nipple discharge, you want to have breast MRI. And for chemotherapy, you want to have breast MRI. And also for implants, you want to have breast MRI to look at the integrity of implants.
Yes.
Those are some of the reasons why you want to have a breast MRI.
And how long does the breast MRI typically take?
So breast MRI takes about 15 to 20 minutes, but a patient should expect to be in the center for about 30 minutes.
Okay. Now I wanted to also ask you about the MRI-Enterography that you provide here. Can you please tell us about that?
This is a study that really is targeted towards patients who have inflammatory bowel disease, or a more common word is Crohn's colitis. And a lot of patients have this pain with abdominal pain and get misdiagnosed or are underdiagnosed or not diagnosed at all. And MR-Enterography is really for young people and really cuts down the radiation dose on them. So you can do an MR-Enterography because MRI has no radiation. And that's the key word here, that there is no radiation in MR, and therefore these patients who have Crohn's colitis can be followed on MR-Enterography, and we can diagnose their inflammatory bowel disease in this examination and safely diagnose and follow them on MR-Enterography.
Does a patient have to prepare for this as well in any shape or form?
Yes, we ask the patient to actually take a bowel prep to clean their bowel the night before the examination. The patient comes into our center, so they take a lot of oral contrast and we distend their small bowel and we look for disease within their small bowel.
Where are the breast MRI and the MRI-Enterography done? Are they done right here at Charter Radiology?
They're done at Charter Radiology.
Oh, so you have everything here.
Yes.
Well, I know, having toured your facility and from our research, you certainly have the most state-of-the-art, technology-equipped facility.
So we have the highest resolution, state-of-the-art MRI machine here, and we are providing some of the state-of-the-art sequences and cutting-edge technology.
We're now going to meet some patients of Dr. Uppal and Charter Radiology. Welcome, Charles. It's a pleasure having you on our program.
Thank you.
I wanted to begin by asking you, Charles, if you can please tell us what brought you to Dr. Uppal and Charter Radiology.
Well, I was referred to Dr. Uppal because of a lower back issue that I had, and the pain was excruciating, so we wanted to get it checked out.
So then you came here off a doctor referral.
Yes.
And you met with Dr. Uppal, and can you tell us what took place?
Well, I came into the lobby and was greeted very well. The staff was very nice. I filled out some paperwork that was required, and they had told me it'd just be a few minutes before I'd get my MRI done.
So then you had the MRI on your back, and what happened after that?
Well, it was interesting because I had a choice of music as I was getting my MRI instead of listening to the sounds.
And then what turned out from the MRI? Was it, what was the problem?
Well, I had bulging disc in my lower back and was recommended to take therapy and so on.
Oh, okay. So it sounds like it was a very efficient appointment. The MRI, you were sent back there to have it done very promptly after you got here, and then the problem was diagnosed through the MRI, and then you had that taken care of.
That's correct.
And how do you feel today?
I feel better, actually.
Wonderful, wonderful.
Knowing what the problem was.
And for the folks out there watching, Charles, what would you tell them about your experience with not only Dr. Uppal, but the staff here at Charter Radiology as well?
Well, they were very pleasant, and very efficient, and they were helpful with my questionnaires and very prompt to have me come to the back quickly. It was a very nice atmosphere as well. I was very impressed that my orthopedic surgeon was located right next to Charter Radiology, which made it not only convenient, but the process of receiving my MRI and reviewing that with the doctor was very quick.
So you got your results back very quickly from Dr. Uppal from the MRI?
Exactly.
Yes, indeed. And on that note, I'd like to thank you, Charles, for joining us, sharing some of your experiences, and being a guest on our program.
Well, thank you very much.
Welcome, Alexa. Thank you for coming down.
You're welcome.
I wanted to begin by asking you, Alexa, if you can please tell us what brought you to Charter Radiology.
Well, I had a back pain in my lower back, and I wasn't sure if I pulled something or if I just landed weird in chair. And so I decided it would be good to come in and try and get it checked out, see what it was.
So you're a cheerleader, and you injured your back doing cheerleading.
Yeah.
And then you came in here, you had the MRI, and what happened after that?
Dr. Uppal met with me right after the MRI and was really nice. She let me actually see them, and she explained how it wasn't anything big and that I just needed to treat it carefully.
Wonderful. So you got your MRI results directly from Dr. Uppal within minutes of the MRI. And lastly, before we let you go, Alexa, for all the folks watching out there, what would you tell them about your experience with the staff here as well at Charter Radiology?
They were really nice and caring. They made sure that I was always comfortable, and they were making sure that I was okay, and they were just really nice.
Well, on that note, we thank you, young lady, for coming down and joining us and being a guest on our program. It was our pleasure.
Thank you.
Welcome, Kay. It's wonderful having you on today as well.
Thank you. It's good to be here to do this.
I wanted to begin by asking if you can please tell us what brought you to Charter Radiology.
Yes, I had some experiences with the local radiology group, actually 3 not very good experiences, and mentioned to my gynecologist, Dr. Schuster, that I needed to go somewhere else. And she had this information and said this is where she would recommend sending her patients.
Now, what type of MRI did you have done? What was the problem, Kay?
There's a strong family history of breast cancer, so it was a breast MRI.
Then you came here, and what's your experience been like?
Well, I first came in to talk to the technician and to explain my experience and why I came here, to see how comfortable I felt. They took plenty of time with me immediately. Dr. Uppal actually called me to reassure me that their service and what I was looking for, made the appointment and came, and was even more impressed. They took unlimited amount of time. The equipment is newer. The positioning was much more comfortable in the machine. And after I had the filming done, the doctor took me right in her office and showed me the film, so I had immediate results. As someone who's been through MRIs looking for possible problems, this is very reassuring to have immediate answers.
Yes, indeed, and directly by the doctor giving you the immediate answer.
Yes.
Which is literally unheard of in this industry as far as radiology practices and waiting on. How many times have we all experienced having to wait on the results from the MRI and then a technician or an assistant from the office calling us?
Well, I will certainly refer people here because of the service, the equipment, and most especially Dr. Uppal.
Yes, indeed. And on that note, I'd like to thank you, Kay, for coming down and sharing some of your experiences and being a guest on our program. It was our pleasure.
Thank you.
We're now back with Dr. Uppal. My goodness, doctor, all the patients can't speak highly enough about you. They love their experience. They love the fact that they're getting their results within minutes generally of having done the MRI, and in many cases you yourself give them the results, which is very impressive and very different from all the other radiology practices.
Well, that is our mission, to give not only the expertise but also the compassion, and that is the mission of Charter Radiology.
Now, we're literally out of time, Dr. Uppal, but I wanted to ask you, before I let you go, you in your practice, Charter Radiology here in Columbia, Maryland, is quickly establishing a reputation for excellence in the Maryland region within the radiology medical imaging specialty. You utilize the latest cutting-edge technology, and I just wanted to ask you what you feel helps separate you and your practice apart from many of the others.
Our technology and our expertise separates us from the other imaging centers. We are diagnosing breast cancer much smaller and earlier, and therefore we're increasing women's life expectancy.
Really, it's a huge benefit, doctor. You're saving so many women's lives by being able to detect the potential of cancer at a much earlier date. And that's what it's all about in eliminating cancer, is to catch it early enough where it's still treatable. And I understand you provide some other services as well that help so many folks out there. Can you briefly tell us about some of those?
We offer expertise in a lot of other areas as well. Musculoskeletal imaging is definitely what defines charter radiology. A lot of the orthopedic surgeons send a lot of the athletes and the non-athletes to charter radiology because of our expertise in musculoskeletal imaging. We also do pelvic imaging for women and abdominal imaging, and also liver imaging is also something that we have great expertise in. So we do a lot of other areas as well, but like I said, as today we talked about two very specific areas, which was the breast and the MR-Enterography.
Yes, indeed. You offer, as you just mentioned, a host of radiology medical imaging services, all to the benefit of so many folks. And on that note, I'd like to thank you, Dr. Uppal, for joining us, being a guest in our program, educating us on some very important points, and we'd love to have you back on in the future.
Thank you so much.